Now, nobody talks about this, but when you listen to people's birth stories, it is the thing that most often catches people off guard and really throws their delivery off of the rails that they were hoping for. Now, for your entire life, you've probably been healthy, your test results have come back normal, but during pregnancy, things really change. And often you get a different test result than you were expecting. So today I want to talk about some common third trimester testing and what you can do with the results to both get the birth that you're hoping for, but also balance what's going on in your pregnancy today. And as someone who has done thousands of third trimester tests, I'm so glad that you're here. And in fact, I've actually had third trimester testing done to me as a mom of 3. So I think this information is going to be super helpful for you moving forward. Okay, so the common third trimester tests. First off, I want to let you know that this list is not exhaustive. There is a fair number of tests that we do in your third trimester, especially if you have something go wrong, but these are the ones that we most often see. And I always want you to remember that your provider is the expert in the room. So they're the ones who decide what tests to give and what will be best to know what's going on for you. The first one is an NST or a non-stress test. This is most often done in your provider's office or it's done in the hospital. And in fact, if you come into labor and delivery and you're past your third trimester, it is something we do on absolutely every patient that we see. It is one of the standards of care in labor and delivery. So when you come into labor and delivery, we put the fetal monitors on you very first to see how baby is doing. Of course, we don't want to be ignoring that because we want to check on baby and make sure things are doing well with them as well as you. And we're doing this when baby is not under any stress. There actually is a contraction stress test. It's not used very much, but a non-stress test is when you and baby are just vibing, nothing bad's going on, hopefully not too many contractions, and we're just seeing how baby does. Now, if you were to stand up right now, your heart rate would change, right? When you're going up the stairs, your heart rate elevates, and a non-stress test is doing that exact same thing with baby. As baby is moving around in the womb, the non-stress tests see if baby's heart rate compensates for how they're moving, just like when you stand up, your heart rate goes up. And that ultimately is what a non-stress test is doing. It's telling us that the brain is reacting to what the body is doing, which is a great sign for the baby. Now, this is just a skim overview of third trimester testing, but I actually have a secret lesson from the online prenatal class for couples that I can give you guys for free. I'm going to put the link down below. It goes over third trimester testing a little bit more in depth, but also talks about things you need to be watching for in your third trimester. So do not miss it. This is like one of the only places you can even find the link because I don't share it very much anymore. Okay, the next test that is often done in your third trimester is a BPP or a Biophysical Profile. Yes, in the hospital, we love is it an acronym? I think that's what it is, BPP, Biophysical Profile. I don't know what STAT stands for, but the BPP is done with an ultrasound and it is measuring a few specific things. It is measuring fetal movement, how much baby is moving in the womb. Baby's muscle tone. If they're just laying in there relaxed or if they're contracted, we want to actually see that baby has the muscle tone to kind of keep themselves like this. It also actually measures amniotic fluid levels. Your doctor can just spot check amniotic fluid levels, but amniotic fluid levels, also called the AFI, is part of a biophysical profile. So the ultrasound tech goes in there and they measure the pockets of fluid. And it checks for baby's breathing movement. You might not know this, but baby is practicing breathing in the womb. They are breathing in amniotic fluid at this point in time, but learning to practice those movements, as you can imagine, is super important because we need baby to breathe when they come outside. So they measure the baby's breathing movements with a BPP. Now, the crazy part is that the NST, which we just talked about, is actually part of the BPP, although the BPP is not always part of an NST. So baby's heart rate and how it's reacting to living in the womb is part of a BPP, and overall we get a score and we can give those results to your provider. Now, I want to know, has your provider talked about any third trimester testing yet? Of course, if you're early in your pregnancy, I'm sure they haven't, but tell us down in the comments, have you heard about any of these before? Now, the last one that I'm going to talk about is lab work. And most commonly, we're ordering preeclampsia labs. A lot of us call it PIH panel. That's what we used to call preeclampsia back in the day, PIH. But the PIH lab set just has a bunch of different labs that we order all together to check to see if you have any symptoms of preeclampsia going on in your body. Now, PIH labs can be done with an NST or other third trimester testing, or it can be ordered alone just for the lab work. And I know a lot of people are like, oh, preeclampsia, that must be super, super complicated. This lab work is ordered all the time. We know exactly what the parameters should be. So really, this is very easily done and very easily diagnosed. So you don't have to freak out that we don't know what we're doing. Now, did you know that there is your own kind of lab that you can use at home, and that is kick counts? I cannot tell you how many people have found problems with their pregnancy due to doing kick counts at home. I have a whole cheat sheet about doing kick counts, as well as tons of other videos on this channel, because I'm a huge proponent of doing kick counts in your third trimester. You can grab the link down below. Now, just like people don't understand third trimester testing, I gotta tell you, there is a ton of bad information out there about inductions. I have a whole video that I'm posting about the myths of an induction. I'm gonna put it up right here. If it's not there yet, though, hit the notification bell and then you can be notified when it's uploaded. Hope you guys have enjoyed this video. Again, the 3 things that are often ordered in your third trimester is an NST, a BPP, and lab work. I'm so glad you joined us here with a pregnancy nurse.